Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India, and today I'll be discussing about the importance of making an oval rhexis and practicing it in these routine cases so that in managing these posterior polar cataracts we are more efficient and more focused and more confident. So here I'll be demonstrating about how to create an oval rhexis in this normal NS2 grade cataract. It's utmost important to practice creation of the oval rhexis so that once you come up with a posterior polar cataract, you are more confident in performing it. The advantages of creating an oval rhexis is it minimizes the turbulence in the capsular bag as it increases the efflux of fluid, and if you are performing a stop and chop or a divide and conquer, then sculpting becomes easier in the longitudinal area. Also, in cases of implanting a sulcus IOL and then performing an optic capture, it becomes very easy. So now the nick is made with the 26 gauge bend needle, and with the help of this Utrata, now I am trying to elongate the rhexis, and once I get a small curve, I again pull it centripetally to get a oval rhexis. So in this case, the length is almost 5.25 mm and the width is around 4.5 to 4.75 mm, a little on the smaller side than I wanted, but then it's okay, the case can be done easily. The nucleus rotates nicely. Now this oval rhexis can be used in all grades of cataract, and here I'll be performing a direct horizontal chop. So I recommend everyone to practice this oval rhexis. This is Cataracts 3 phaco machine. Bevel down, a bit of cortex is removed, and then the bevel is turned up. Now as this longitudinal axis is more, I can easily perform maneuvers in the bag. So while performing this horizontal chop, I can take the karate chopper to the far periphery easily and divide the nucleus. So we've got a good crack. Now rotating the nucleus 180 degrees, and now I have got two heminuclei, and going deep into the heminucleus, holding it and chopping. Now I have two pie-shaped quadrants. Now again rotating the nucleus, bringing it towards the 6 o'clock position, again holding it nicely and creating a crack. So now I have four pie-shaped quadrants which can be emulsified easily. So this technique has been popularized by Dr. Kiranjit Singh. I'm highly thankful to sir for giving us this excellent technique where we can confidently perform phaco in tough cases like posterior polar cataract. And by now most of the nucleus has been managed. Now is the time to remove this cortex. Cleaning the cortex is also easy, and bimanual is of great help. The external red glow is switched on, so I'm getting a good reflex, red reflex. enhancing my visibility. This bimanual IA by Oatly is excellent, no financial interest, but everyone should give it a try. The bag is nicely cleaned. And now is the time to inject the IOL. Once the IOL is in the bag, it will be nicely covered by the anterior capsule. Giving it a good long-term stability. So this is a hydrophilic IOL. The leading haptic goes in the bag. And the trailing haptic is then dialed in. You can see that the anterior capsule over the longitudinal sides is nicely covering the optic. And now cleaning up the OVD from both above and behind the IOL. So the take-home message is, all the beginner surgeons should practice this oval rhexis in their routine cases, so that once you face a posterior polar cataract, you are more confident in performing the case, and it has a lot of advantages. So it minimizes the turbulence in the anterior chamber. It helps you in sculpting end-to-end removal of the nuclear fragments from the bag, and in cases in need of doing an anterior vitrectomy, it helps without stretching the bag. We can do a nice vitrectomy. And in case of need of sulcus fixation with optic capture, it helps and gives excellent results. I hope you like this video. Do like and subscribe to my YouTube channel. Thanks for watching.